All right, hi everybody, it's Dr. Charmaine Johnson from Premier Smile Center again. Today I want to talk a little bit about how to prevent a dental emergency. So I'm all for social distancing. I want you all to stay at home, just go to the grocery store, the pharmacy, the doctor, the bank, and that's it. Because the more we are all practicing social distancing, the shorter it is that we have to do it. So I'm going to go over a couple of things that hopefully will be helpful to help you prevent a dental emergency. The first thing is, what if you had gum disease in the past, or your gums are hurting, they're puffy and swollen? What do? So number one, make sure you're following your regular hygiene routine, brushing twice a day along the gum line, flossing daily, using little bottle brushes, using your water pick, and then rinsing with the mouthwash. The mouthwash is either Peridex if you've been prescribed that, if you had gum disease before, hydrogen peroxide 1%, or just plain old warm salt water rinses. Patients have told me they find it hard to get hydrogen peroxide. So just take a teaspoon of salt, dissolve it in a glass of warm water, and rinse out 2-3 times a day. Keep everything nice and clean. That's going to help you with gum disease. The second thing is, what do I do if I have a temporary crown, or I have crowns in my mouth, or large fillings? Well, number one, do not chew on ice, don't eat popcorn, don't chew on hard candy, and certainly don't eat anything sticky like gummy bears, chewing gum, anything like that, taffy, because that will certainly pull out your fillings, it'll pull out your temporary crowns or even your crowns, and then you'll have to come in and see me. The next thing is, what do I do if I have some pain? Well, on a scale of 1 to 10, what is that pain like? If it's a 6, 7, 8, 9, then certainly give us a call and we'll help you with that. But if it's not too bad, once again, rinse with warm salt water and just keep the area clean. What if I've broken my tooth? I ate something and I broke it. Well, if you are in pain, then give us a call, because that is a dental emergency and we'll help you fix it. But if not, just rinse the area out well and just keep it clean. Keep it flossed, keep food out of the area. If it rubs on your tongue because of the sharp edge, then you're going to form an ulcer. Just rinse your mouth with warm salt water and try and avoid touching that area with your tongue. What you could also do is probably get some orthodontic wax, which you can get from the pharmacy, and just fill in that space or cover it so that it doesn't scrape on your tongue anymore. Okay, so now a lot of us have kids at home and they're probably bored and fighting with each other like my kids, or bashing each other. And what if you fall and your tooth comes out? That's an emergency. So what you're going to do is you're going to take it, rinse it very gently in water, and put it on the inside of your cheek, and give us a call right away so that we can help you put it back in the socket and splint it back in. If that grosses you out too much, then put it in a glass of milk and come over right away. We'll help you put it back in. But certainly don't scrape on the root or anything crazy like that. Okay, so what if I've got an object stuck between my teeth and I can't get it? Well, continue to just gently floss it, trying to get it out slowly. Use a water pick. Don't use a sharp object and try and pick it out, because you may just hurt the gum tissue and then now it will get infected. And then 2 last things. Wear your night guard, wear your retainer. Because if you're a clencher and grinder at night, you could potentially chip and break your teeth if you're not wearing your night guard. Then lastly, if you're a dry mouth patient, you just have a lot of dry mouth, you've had chemo, radiation therapy, or you're on a lot of medication, then constantly sip on water. Use the water as if it's going to replace the saliva that your body's not making, because that will help the flushing effect, it'll help with the dry mouth, and any issues with that. So I just wanted to kind of give you some insight and let you know that if you have any other questions, we've developed a teledentistry portal. You just have to call the office. We can set up a virtual video call with me, and I can just help you through any questions that you have. The number is 954-566-7479. Hope to speak to you soon.